Gurmagad Ara, and thank you to my colleague Senator Clifford Lee, and to all of the senators who have spoken here today and on this important motion. Minister, I welcome the fact that we have clarity on the naming of the hospital, that it is a government decision. I accept that the government's number one priority is on the commissioning and the opening of the hospital, and that is exactly what the government's priority should be, and we 100% support that. I want to also acknowledge, I suppose, the contrary views or the questioning views. They're healthy, and it's important that we do question decisions and we do question proposals. I will respectfully, obviously, disagree with the proposition that this is not, that the name would be in any way inappropriate. I believe that in naming the hospital, it isn't just about us paying tribute to Kathleen Lynn, who everybody has spoken about so eloquently as not just a medical doctor, as a politician, as somebody who made an enormous contribution to society, as a feminist, as a suffragette. But it is also about acknowledging all of the unnamed women, all of the women of previous generations who haven't been written out of our history, who aren't household names. But it is most importantly, I believe, about setting an ambition for the future of the delivery of healthcare. And Minister, you very eloquently and comprehensively outlined what a state-of-the-art, world-class health facility the new Children's Hospital is going to be. It is as it should be. But what's really important, not just the technology, not just the built environment, not just the expertise, but it is the heart of that hospital. And it is the values of all of those who will be cared for and all of those who will do the caring in that hospital. The values that Kathleen Lynn absolutely epitomised, the values of equality, the values of competence, the values of professionalism, the value of compassion. Patients need more than anything compassion and understanding, and she was a woman who had it in abundance. And while we may achieve some small progress in terms of increasing her name recognition if we name the hospital after her, what will be achieved in generations to come by all those who serve in that hospital, who care for children and their families in that hospital, in promoting the values that she lived, will be an enormous gift for us to give. And I appreciate there are dissenting voices. I do also appreciate that there had been a motion previously brought to the House which was passed unanimously, albeit without debate. I suppose that's part of the reason why we brought the motion forward again, because it is important that there is a strong mandate for this. We can debate the process by which naming of buildings or any other structures take place, but this is an essential, vital, social infrastructure. It is going to be a public hospital, as you've said. It is a state intervention. It will be a state intervention into the future. And we want to set a mark and a value for that state intervention and that state provision of healthcare services, that those services will be provided based on patient need and based on compassion and social justice. So those who are dissenting, if they wish to call a vote, let's have a vote and let's put that on the record of the House. Otherwise, I wanted to go forward from this House that there is unanimity here, and that is a strong message to government, because the branding exercise that's taking place is something that obviously has to take place, and I support the completion of that exercise. But I really would caution against us defaulting to a position of comfort and security, of sameness. Irish people are very unique. We have a very unique culture. We have unique personalities. Let's not dumb it down. Let's not pretend to be some corporate, uniform, same medical facility. Let's be very clear and very proud that our finest, and it will be the finest healthcare facility for children and families, is one that is not only technically and operationally and professionally of the highest standards, but it is also of the most human, highest values of compassion and social justice. I ask you, Minister, to take that message back to government and to urge government to name the National Children's Hospital after Dr Kathleen Lynn. Gormagad.